Dr. Gregory Johnston behind the camera, and we're filming Joseph and Corey. Corey has finished his 8th treatment here in Houston at Advanced Chiropractic Relief for his hiatal hernia and acid reflux condition. And I'm going to let him tell you, a lot of you are out there watching these wondering whether it's worth coming here or not. I'm going to let him answer that.
Yeah, I had the same question coming into it as well. If it was worth coming. Tried a lot of different stuff, and I was a little skeptical, a little scared, I guess you could say, to come here, and it's proven me wrong. I feel really good, loosened up. The problem is really the pain is dissolved a lot. I feel really good and loose and light. So yeah, these 4 days have been really beneficial to me.
And has the acid reflux improved overall? Have you been able to eat more and do more?
Yeah, I've been eating, normal, great. It's definitely improved. Like I said, the pain is
good old Tex-Mex food here in Houston.
Absolutely.
Steak last night.
Nothing but the best here.
That's
yeah.
it.
Yeah.
Good.
Yeah,
so now we're going to get to watch Joseph work on you.
Yep.
So, you have anything else you want to tell everybody?
No, I mean, if anyone is questioning it, I think, dive into it, and if you're having some pain or some problems and you need an answer, I think this is the one.
Thank you very much.
Absolutely.
Okay, Joseph, I'll let you do your intro now.
All right. This is Joseph, and I'm going to work on Corey's paraspinal and erector muscles down into his glutes. And then I'm actually going to have him turn over, and I'm going to work on his psoas muscle in his abdomen down into his hip area. He's already been adjusted by the chiropractor, so his body is now in alignment. And so now I'm just going to go back, give him some nice deep work along those spinal muscles.
Been a long week, huh?
Oh yeah. Corey's been here for 4 days already, so he was a little sore, but overall he does feel a lot better, and he's been eating great. He's been to the best restaurants here in Houston, so
definitely eating good.
And as you see, and as Corey could probably tell you, I'm using a lot of pressure along these muscles here so that the muscles will become relaxed, and his adjustment that he had will stay longer, especially since he's leaving today. And I just use a bunch of different techniques. I don't use the exact same techniques every time. I try to do it different every time I see him or see a patient. I'll use compression, I'll use trigger point, I'll use my elbow, get deep down in there, kneading techniques. But I do work along these spinal muscles. I'm not only just pressing down, but I'm also pulling laterally, which is towards the outside of the body. So I'm going down into the muscle, and I'm pulling out into the body. Sometimes I'll add another stretch in here just to make sure I'm getting all the movement I can within that muscle. And Corey's sensitive spots or tightness spots are right here in his thoracic spinal area. This is what may be causing or is causing his acid reflux, because his ribs are out of line in the back in his thoracic region. So I'm going around those muscles, pulling them out where the doc has just adjusted his spine in that area. This will help the reflux stay down, help belching, help GERD, any other symptoms that he may be having.
And besides that, it feels great.
Yeah.
Oh yeah, feels real good.
Deep tissue can be relaxing to some degree, but it does feel better when you're done.
It's one of those hurt so good treatments.
Hurt so good treatments, yes. I've had a lot of practice with my elbows, so I actually can feel the muscle tension with my elbow. I know what it feels like under my elbow. I'm just rocking a little bit, trying to get the extra stretch around his paraspinal muscles. Go down into his glutes and get his piriformis muscles. His glute maximus, minimus, and medius. Going up his lumbar spine. As you see, I'm rotating my fingers in and back out to get this stretch. And you can you feel that going over those muscles
Yeah,
there?
definitely.
So after I warm up his thoracic muscles, now I'm going to give him a little deeper treatment. And that's where I bend his leg. He's still relaxed. I got his leg. He's not holding it up for me or anything. And then I'm going to go into his piriformis muscles, which is right in the meat of his glute maximus, close to his hip bone. I'm going to pull his leg up, rotate it out, rotate it medial, while putting my elbow in there. Bring it down, let him relax a little bit. Then I'm going to move farther up the sacrum into the lumbar area. It's a good stretch. Corey will probably tell you he feels this on his quad in the front as well.
Oh yeah.
Which is where I'm going to go next, because his psoas muscle into his abdomen down into his hips has been giving him some trouble.
We want to clarify for some of our YouTube watchers, psoas is a actual muscle, not sore ass.
P-S-O-A, psoas. Alright, so now I'm going to come back to the other side, do that. And I'm going to have Corey turn over for you guys here. Corey's had some soccer injuries he was telling me earlier with his hips, so that's why I've been doing a little bit of extra work on his hips and hip flexor muscles. Alright, Corey, turn over for me. Now, what I'm about to work on is a very sensitive area. He'll be able to tell you this isn't a fun area to get worked on, but it does feel a lot better once you're doing it.
Yeah, once you're done.
Feels better when it quits hurting, right?
Yeah.
And I'm actually getting deep down in there. You can see my fingers are in there. It's kind of like when the Dr. Johnson is pulling on his stomach. I'm deep down in there. And this is just the most simplest way. But if I really want to affect that muscle, I'll bend his leg here. First, I'm just going to give him a little stretch. But now this muscle is engaged. And I can get all the way down in there. And he's just breathing normal. He's trying not to hold his breath, even though he probably wants to. But if he doesn't, it'll feel better. Getting in the psoas muscle, down into his abductors and adductors here in his medial thigh area, into his groin area.
Those are very tender too, huh?
These are tender, especially right here. He'll probably tell you.
That's the gracilis in there, right?
You can see his face moving. Yes, this is gracilis muscle. So I'm just working on that. Alright, come to the other side now. So yes, your psoas muscle is right here. It attaches, the back of the spine goes all the way down here, down towards the hip. Give you a little stretch. And you can see his gracilis muscle, it's tight. It's like a stringy rubber band. My fingers are just going, strumming it. It's so tight. Alright, how you feel? You feeling better?
Yeah, let's loosen it up.
Alright, so this is just some of the treatments that we do here at Advanced Chiropractic Relief. You'll come in, you'll get adjusted by the doctor, then you'll come and see me. We'll do a lot of manual therapy, some stretching, different body movements that will be specific to you and your issue or problem that you're having with your own body. The doctor and I communicate back and forth. We come up with a plan designed specifically for you. So if you come see us, you're going to get the best of the best. You'll see him, you'll come see me, and we're going to treat you right, have you out here, back out, living your life great, back to normal as quickly as possible. We're not going to put you on a long treatment plan. We're going to put our hands on you, and we're going to have you right and back at normal health as quickly as possible. So this is Corey, Joseph, Dr. Johnson, and Renee over there, coming from Advanced Chiropractic Relief here in Houston. We'll see you next time.